I appreciate this is a difficult question, but you touched on it's difficult for vets in the front line, and certainly within your practice network, who are then presented with animals that potentially have had procedures done, acts of veterinary surgeon outside of veterinary supervision. And talk in general terms if that is easier, but what sort of procedures are you picking up that have been done? Is it blood samples? Is it artificial insemination? Or heaven forbid, are you picking up that things like caesarean sections are being performed not by veterinary surgeons?
So definitely blood samples,
Yep.
Definitely artificial insemination. And there has been cases where caesareans have happened. The problem is we don't know if they're done by veterinary surgeons or not veterinary surgeons because there is a wall of silence and we have no medical notes. So I wouldn't like to say whether it is one or the other. But this is part of the problem, is the wall of silence, because as we know as veterinary professionals, you have to keep medical records, you have to share those medical records, and you have to keep them for a period of time. And that is an important part of an animal's history and is an important part of treating them for their health and welfare. And if we are in the dark on that, that is a problem going forward. But we have definitely seen all of those.
And you're picking up that some of these procedures have been done. How common is it? Is it many? Is it few? What are we talking?
I don't think it's common, and we are not absolutely tracking them. But what I would say is that as the group veterinary officer, I am hearing this from our practices where we have not heard it before, and it is a concern. Mainly the concern of the distress it is causing, and they are themselves showing an emotional response to something they do not wish to see and feel powerless to do anything about.